Welcome to this explainer. Today, we're diving straight into a truly fascinating and honestly totally misunderstood frontier, where ancient contemplative practices violently collide with modern human biology. We're going to look at what exactly happens when internal energy cultivation, things like qigong or intensive yoga, goes catastrophically wrong.
Okay, let's dive into this. For decades now, the mainstream wellness industry has essentially sold us this one very specific narrative, right? The idea that meditation, breath work, and energy cultivation are always relaxing, always healing, and purely beneficial. But what happens when you push the human nervous system a bit too far, to the point where it actually becomes dangerous? What happens when these practices trigger this intense biological cascade that completely overloads your body's circuitry?
Well, as practices like Qigong, Nigong, and Kundalini Yoga have absolutely exploded in popularity, medical professionals and psychiatrists are running into more and more patients presenting with these complex, honestly terrifying syndromes. We're talking about severe, catastrophic disruptions of physiological, psychological, and energetic balance that just completely defy our standard psychiatric categories. The people going through this experience intense physical pain, total autonomic nervous system overload, and sometimes even psychosis.
Section 1, Path A, Qigong Deviation Syndrome.
So, looking at the Chinese tradition, this crisis is known as Zhao Hou Ru Mo, which we call Qigong deviation. The terminology here is just incredibly descriptive. Zhao Hou translates literally to a spark, a short circuit, or catching fire. And Ru Mo means to be possessed or obsessed. In traditional Chinese medicine, this symbolizes an excess of heat, literally like a fire, moving uncontrollably upwards into the head, which leads to highly disordered thinking and extreme emotional agitation. And this brilliantly illustrates that we aren't just talking about a folktale here. Qigong deviation is an official, recognized diagnostic category in the Chinese classification of mental disorders, the CCMD-2. This became heavily scrutinized during the whole Qigong fever of the 1980s and 90s in China. Millions of people started practicing, and consequently, thousands began showing up in psychiatric wards. So, what actually triggers a Qigong short circuit? Well, looking at the literature, it almost universally stems from improper practice. That could mean just following a book or YouTube video without a qualified teacher, or having this extreme impatience to lift the qi way before the body is physically ready for it. A lot of vulnerable individuals just overperform the exercises, getting completely fixated on gaining special powers or escaping reality. From a biophysics perspective, they're basically inducing this unstable quantum to classical transition in their bodies, completely overwhelming their biological systems. Medical reports document some pretty intense, quite frankly, terrifying clinical phenomena here. Patients report these wild sensations of qi dashing and rushing right into the head, which leads to severe headaches and even paranoid delusions. We also see motor phenomena, involuntary jerking, shivering, spontaneous movements. There's even this famous subset where individuals spontaneously break into frantic crane flying motions, driven by autosuggestion and these overwhelming energetic surges. It all culminates in intense anxiety and total emotional exhaustion.
Section 2, Path B, Dark Kundalini Syndrome.
Now, shifting gears to the Indic tradition, we encounter the concept of Kundalini. As you probably know, Kundalini is described as a dormant, vital power, this primal energy believed to reside right at the base of the spine. Through intense spiritual practices, breath work, or sometimes completely out of nowhere, this energy can awaken and rise forcefully up through the body's energy centers. When it happens harmoniously, it's said to lead to profound spiritual awakening. But when it goes off the rails, we enter the dark and incredibly painful territory of dark Kundalini syndrome. When that Kundalini energy spikes too fast or too forcefully, it completely overloads the nervous system. And the symptoms are terrifying for the sufferer. People describe these intense, high-voltage electrical sensations literally burning along their spine. Their nervous system basically gets locked into a state of chronic sympathetic breathing overdrive, essentially a permanent fight-or-flight response. This leads to deep anxiety, heavy depression, intense depersonalization, and a very real, palpable fear that they are losing their minds. One expert source actually captures the physiological reality of this perfectly, stating, "In this entire combustion process, your nervous system goes haywire. It becomes unable to cope with such a high voltage of electricity, and instead, it shifts into its default freeze mode. The person's physical body is literally short-circuiting under a massive energetic load that it just hasn't been conditioned to handle yet." Section 3. The intersection. Comparing the symptoms. Let's move to and see how this builds.
So the most vital shared diagnostic marker between these two, Qi-Kwang deviation and dark kundalini, is this thing called the thermic effect. Sufferers from both camps report this profound, often physically painful sensation of intense heat or fire just moving upward through their body. This physical somatic heat is incredibly rare in standard clinical psychosis, which makes it the absolute key indicator that a clinician is dealing with a bioenergetic crisis rather than a standard psychiatric event like schizophrenia.
When we map these symptoms out side by side, it's fascinating. We see distinct cultural differences that are basically masking identical biological breakdowns. Just look at the motor cluster. Qigong manifests as those frantic crane-flying motions, which contrasts with Kundalini's involuntary yogic postures and heavy trembling. Sensorially, Qigong sufferers report a localized qi dashing to the head, whereas Kundalini sufferers report a full-body intense burning. But while the cultural expressions look different on the outside, cognitively and effectively, both result in the exact same terrifying existential crises and profound panic.
So the crucial point is, what on earth is physically happening inside the body? Modern frameworks point us right to a shared pathophysiology. First, we see quantum decoherence, which is basically when your body's microscopic bioinformation systems totally lose their stable organization. We also see piezoelectric discharges. That means physical, mechanical energy stored in the body's deep fascial networks is literally converting into actual electrical sparks, causing those tremors. Meanwhile, the HPA axis, your body's main stress response, gets stuck in a chronic on position, just flooding you with cortisol. And finally, intense practice has actually been shown to decrease dopamine and serotonin binding in the brain, which completely distorts your perception.
Section 4. Techniques for resolution. Knowing how intense this all is, how do practitioners and medical professionals actually treat and resolve these overwhelming states? This is where contrasting the distinct resolution techniques of the two traditions gives us some amazing insights. To resolve Qigong deviation, the whole focus is on pulling the energy down. Practitioners prescribe slow grounding movements, acupuncture, and heavy use of tuina massage to physically redistribute that stagnant qi right out of the head. Now, contrast that with Kundalini resolution, which heavily relies on autonomic nervous system hacking. This means adopting 24/7 diaphragmatic belly breathing, utilizing external breath holds to directly reset the vagus nerve, and prioritizing intense exposure to sunlight and negative ions out in nature to ground that massive electrical charge. But despite those very different specific techniques, both paths ultimately require these three core foundational steps to unlock the nervous system out of that freeze mode. Number 1, you absolutely have to ground the physical body. Number 2, you must restore parasympathetic tone, getting out of that constant fight or flight, usually through highly specific breath work. And number 3, providing transpersonal support, meaning the person desperately needs an experienced guide who actually understands what they are going through on an energetic level. And that need for transpersonal support brings us to a really vital point: destigmatization. If we're going to help people heal, it is absolutely crucial that medical professionals and society as a whole frame these events as a spiritual emergency rather than just some catastrophic mental failure. Treating someone who is undergoing a Kundalini or Qigong crisis simply as a psychiatric patient with latent schizophrenia almost always worsens the trauma. They are undergoing a highly complex biological reaction to intense contemplative practice, and that requires real, holistic integration. Which leaves us with a pretty profound question to chew on as we wrap up this explainer. With millions of people diving into meditation and energy work every single day, we really have to ask, are these syndromes just rare cultural anomalies? Or are they entirely predictable consequences of tampering with the high-energy interactions within the human bioquantum system? Honestly, maybe understanding this short circuit is the very key to understanding the biological substrate of human consciousness itself. Thanks so much for joining me on this deep dive today. Stay curious and take care of your energy.